Well, long COVID patients are having to wait a long time. The St. Luke's COVID Recovery Clinic is backed up for months. It's leaving some people with ongoing COVID symptoms without treatment. And News Channel 7's Andrew Bartline talked to the COVID clinic today. Andrew, what's leading to this backup?
Well, part of it's just Idaho's growth, Shira. St. Luke's says all sorts of health care, but specifically specialized health care is backed up because there's just more demand as Idaho grows in population. And people at the back of the line aren't sure what they can do in the meantime to get treatment for their ongoing symptoms. There's a few art pieces off Vista Road, but take a closer look and find the real artist of Vista hidden in a strip mall.
Dogs, such good dogs.
Mike Rogers.
I'm obsessed with it.
Makes custom jewelry with his dogs, Cellini and Sophia.
They're not any help whatsoever.
Mike's not the type to ask for help.
What do we got?
He chooses to work alone.
It's just one guy making art in this little studio. And that's how it's always been for me. I mean, it's been like that for 35 years now.
Decades of experience doesn't compare to the last couple months.
It hit me like a ton of bricks.
Mike caught COVID more than 2 months ago. His symptoms changed, but they're far from gone.
Thinking, well, okay, tomorrow's better. And it really hasn't been so far. I'm still sleeping 11, 12 hours a day. I've got a weird buzz in my brain.
The one-man show admits he needs help. Mike's doctor wrote a referral to the St. Luke's COVID Recovery Clinic.
Call these guys, they're hard to get into.
Still, Mike gave it a shot.
She left me with the impression that I wasn't going to get in no matter what, and if I did, it was going to be November.
We are working to try to increase capacity.
St. Luke's Dr. Laura McGeorge works at the COVID Recovery Clinic. She says people are waiting 2 to 3 months to be seen.
A lot of people moving into the community and demand everywhere is growing.
Long COVID symptoms include fatigue, brain fog, short breath, chest pain, cough, and heart palpitations.
I did not expect it to be quite this intense.
You really can set yourself back if you push too hard, and often it's better to just go forward, one step at a time.
Without availability at the COVID clinic, Mike's doctor says his next step is to see a neurologist.
I am struggling to get that help.
For a guy who's not used to asking for help,
On this ring,
Mike's not sure where the step will take him or if he'll get any answers.
This is a little more of a pressing issue for me. I don't even know what to do, right? I mean, you call people and they're like, yeah, it's going to be a bit. We'll get back to you. Then they don't get back to you.
McGeorge says St. Luke's COVID clinic is starting to see more people infected with the Omicron variant, so St. Luke's now knows definitively Omicron can lead to ongoing symptoms and long COVID like the previous variants. As for Rogers going to see a neurologist, St. Luke's says that's a good option for some symptoms, but of course everything's case by case. The best option for you if you're in a similar position is to talk with your primary health care provider, and your doctor can direct you to what your best steps are for your specific situation.
Good information there, and just, I guess, another impact of our growing Idaho, right?
Yep.
All right. Thanks, Andrew.